Since the pandemic and the necessary stay-at-home and social distancing recommendations, 20 to 30% of adults report that they are feeling lonelier now than pre-COVID. Loneliness occurs across any age, income level, living situation, and gender. However, the highest rates were among those with lower incomes, LGBTQ+, and those living alone.
I think we're going to need to be as creative in bringing people together as we've been about separating them.
We are not going to go back to normal. We are going to go forward to a new reality.
The Motion Picture and Television Fund, MPTF, and the Milken Institute Center for the Future of Aging convened the Social Isolation Impact Summit to confront the realities of isolation and loneliness and the risks to older adults. The takeaways from the 1,200 participants lay the groundwork for a socially connected while physically distant society.
Through various state efforts, from the Neighbor to Neighbor campaign to the Friendship Line to the recently launched Social Bridgers Project, Californians across the state are checking in and connecting with millions of seniors who otherwise would not have these crucial touch points of human relationship and interaction.
What you see on the ground, people have both expanded their services to meet the moment and redesigned.
But the respect for underlying community structure, practices, and leadership, absolutely important.
I think the stereotype that older Americans are kind of slower to adopt technology or unable to adopt technology as a solution, that ends up being kind of a justification for a stratification around solutions for loneliness that oftentimes kind of robs certain people of actually digital solutions and tools.
It's about the affordability, it's about the broadband, it's about the content being useful and interesting and relevant at that stage in your life.
We're in the process as area agencies looking for technologies across the country and literally across the world at this point to see what we can adapt to provide for the needs of our communities in Los Angeles.
One of the things that challenges us with social isolation is really studying what interventions work.
We're looking at programs like the Friendship Line. We want to study the effects of the Friendship Line in California, but we are currently unfunded. And that is very difficult, therefore, to show the evidence.
We really need to flip the script on that and really make sure we're shoring up our social safety net, just as we think about our medical safety net.
We must act now and use the COVID pandemic as an opportunity to educate and reach out to policymakers and funders.
Together, our human resources, our financial resources, our intellectual resources, we can do this together.